Well, good afternoon, everyone. Thank you very much for being here today. We're really proud to be standing here with one of our newest things that we have in Anderson, particularly to help our employees, and it's the Employees First Choice Healthcare here in Anderson, which is dedicated to the Anderson City workers who have health insurance with the City of Anderson through their plan. And the purpose of this is to make sure that folks have good health care, they have wellness care, but in particular that they have good care that's cost effective. We're going to talk a little bit about that. We were able to repurpose the building behind us, which you guys will remember was the old dispatch center here with the City of Anderson. And when we transitioned over to the working with the county on our dispatch center, we had this empty facility. For some time, we tried to determine what we might do with this, and through the work with the Health Commission, folks I'm going to introduce you in a few minutes, they were able to come up with the idea of transitioning from the former health clinic to this particular location for a health clinic, and then we partnered with a new team of Care ACT. We're going to be talking about that in a few minutes too. And this also not only helps our employees, but it also helps the community at large, because a large portion of what we pay and costs each year, of course, is for employee benefits and employee salaries. And those benefits are, of course, one of the most important parts and expensive parts of the benefits plan. And this helps hold down the costs. In fact, because of the Health Commission, the work they've done over the last several years, it's been 5 years plus since we've had to increase the cost to either employees or to the city itself for health care. And there's not very many places around that can say that. And part of the reason is because of this health clinic and health clinics like this that we've had in the past. And we believe that this particular clinic will even help us keep those costs down even more. So first thing I want to do is thank the Health Commission that are here today, and I hope I don't miss somebody. Mike Anderson with Anderson Police Department is on that. He's also president of the Fraternal Order of Police here locally. Ryan Green is one of our members. We appreciate, Ryan, everything that you do as well. We have Katie Kroll with the Personnel Department and with insurance. Thank you. Dick Sims. Dick is with the Board of Works. Cody Lever. Cody is also with the fire department and is also president of the local firefighters union. And Doug Whittam, who's our city controller. And then also David Ikes, who is the chairman of our Board of Works. Again, the commission was created several years ago pursuant to a ordinance, and it oversees our health programs, and it really is a way to take politics, so to speak, out of it, to make sure that it's done in a way that's fair and equitable and cost effective for the community. And these guys and gals have all done a great job on what they're doing. So with that said, I'd like to introduce to you the physician who's the director. I guess that's your title. I'm not sure your title's that. I know Angie's here too. Angie is the director of operations for the program, but Dr. Stephen Smith, who's board certified in family medicine, has practiced medicine for a number of years, does a great job. I've been a patient of Dr. Smith myself, and I can certainly recommend him. Dr. Smith, tell us a little bit about the clinic, how you got involved, and more importantly, tell the folks at home and our employees what they can expect and what they need to do if they want your services.
Well, I've been doing this a long time, over 30 years, and it took me a long time to be able to try to carve out a niche for myself in modern medicine. I'm not the kind of guy that can run 30 people through the office a day. I need to be able to spend time with each person, get to the root of their issues, get to know, what they're about, find out what their histories are, and come up with a good plan that works where they live. Basically, what works in your life. And that's what I try to do with each person that comes through here. My understanding is that, each person that's an eligible employee of the City of Anderson or a dependent can simply contact us through the published numbers. Our numbers here dial directly into the office. That's not always the case with the other clinics that Care ATC runs, but that's a special perk for the folks here in Anderson. So we're very proud to have that. However, we can't always answer the phone. We're a very small, lean staff. And if we're back working with patients, there's nobody there to answer the phone. So it rolls over into Tulsa with the answering service. Please just be patient. let it roll over, let somebody pick it up, and usually we're quite good at getting back to folks right away when you call in so that we can see you that day or the next day that we're open. So we try to be very, very receptive to your needs and get you in as soon as possible.
Well, Doctor, tell the folks what type of care they might expect. This is not an emergency facility, so explain a little bit about the type of services that they should expect and when they should call and maybe when they shouldn't.
Okay. Certainly if you have an emergency, don't call here. Head to the emergency room. What constitutes an emergency? You have chest pain. You can't breathe. You're numb or weak on one side of the body. You know, those are things. Don't try to get through to us. Get yourself to the emergency room. But, you know, for most other things that can be handled at a family practice office, small sprains and strains, I probably wouldn't come here for a possible broken bone. We don't have x-ray equipment. Not yet. So go to the emergency room or an urgent care. But sprains, strains, coughs, colds, you know, the standard things that you would go in for family medicine. Also, we take care of high blood pressure, diabetes that's not too complicated. You know, many of the other diseases that are chronic, that, you know, high cholesterol, other things of that nature that can be handled in a family medicine care clinic can be handled here, and we can give you the medication that you need generally at no cost. We're well stocked with very good medications. Can't always take care of you with free medicines, but I do my best. And we also have a program, ElectRx, through the city, where we try to get those other meds at the lowest price that we can for folks.
And I know you have a program too through the clinic and through the city where certain meds, so once you've prescribed them, that, like you said, you might be able to give them here, but at the same time you can make arrangements for folks to have direct delivery to their home.
Right. We have a pharmacy out of Indianapolis, Northwind, that mails 3 months supplies of medications directly to your home. That has worked exceptionally well with very few mistakes. And please let us know when mistakes happen, because we want to rectify it. But I've been amazingly surprised at how well that has worked, because usually something goes wrong, you know, with something like that. But it's done very, very well, and people have been very happy with it.
And in addition, I know you do some lab work and do some blood work. Might talk a little bit about that.
Sure. We draw a lot of different labs for folks. If you have an order from your physician and you want your labs done at generally no cost or lower cost, you can come here and have most labs drawn. We will let you know if something is outside of our ability to draw. You need to go to a drawing site. We also draw, you know, most of what I order right here. And most of that is very low cost to, you know, all the beneficiaries that use our clinic.
And then you have a lab that you have an association with, LabCorp, I think, that actually does the work on the blood, right?
Right. So LabCorp has a pickup box here. They pick up daily, and I will usually have results within 1 to 2 days. That's with most standard tests. Now, some tests are, you know, tests that take a little longer, vitamin levels, things like that. But most tests, we'll get them back in a day or two. So the turnaround time has been great.
That's great. And your hours, I know right now a little bit abbreviated, but we'll talk about that. I might ask Angie if that's okay. Sure. Angie, bring you on in here for a minute. And you are the Director of Operations. Yes. And so anything that Dr. I should have asked about that we didn't mention that you can think of?
I think you asked all the right questions, but I would say, well, part of my role is to also work with this health commission to continue to develop our services and bring more of a comprehensive care to the city of Anderson employees and their families. And but this is a great start. I see this. Is that a segue into what you want to say? Is that I see this expanding into something more, into more hours and more services that we can offer the employees.
I know you do have posted both on the website as well as out on your sign, but tell us right now what the general hours are.
This health center is currently open on Mondays from 8 to 5, Tuesdays 2 to 6. We're closed on Wednesdays. Thursdays open 8 to 5, and then Fridays open from 8 to 12.
And when you are open, Dr. Smith's on site, and then you also have some other folks here. You might want to go ahead and introduce them.
Right. This is Brittany.
Hi, Brittany.
She's our medical assistant here at the clinic, so you'll see her smiling face when you come in, and she'll greet you and help take care of you and help Dr. Smith with whatever he needs.
Well, I want to thank everybody again. I also want to acknowledge Tom Brown. Tom has unfortunately passed away, but Tom was a former personnel director, and I know he was involved. He was on the commission and also was very much wanted to make sure that we had good health services for our employees. And so we were proud, and I know David worked closely with Tom, and I know we were all proud to be able to carry out part of the vision he had as well as that of the commission at large. So with all that said, we'll go ahead and make this official. I know you guys have been open for a little while now, but Dick has the scissors. Doctor and Angie, if you guys don't mind, why don't you come up here and kind of get a hold of the scissors. And they're sharp. I know you got Band-Aids, but you still want to be careful. And we'll go ahead and let them take a couple pictures. And then we'll go ahead and do a countdown with everybody, if you don't mind. 3, 2, 1. It's official. There we go. Congratulations, and thank you again, everyone. Thank you. Well, I'm here with Cody Lieber. We introduced Cody a few minutes ago with the rest of the folks. Cody is on the commission, the insurance commission. He also happens to be the president of the Anderson Firefighters organization here, Local 1262. And Cody's been a longtime fireman in our community. We appreciate your service to us for that. But today we're here to celebrate the opening of the clinic, and I know you were involved directly with that throughout and as part of the commission. And you might talk a little bit about, from your viewpoint, having served on a commission, what the commission tries to accomplish and whether or not you feel like that's heading in the right direction, and then talk a little bit about the importance of this clinic.
Oh, thank you, Mr. Mayor. I think you absolutely hit it head on. This is a pure example of labor and management coming together through this commission, through ordinance, and just doing what we've done with the insurance in the city as a whole, but then this, being able to provide a clinic like this to the employees and our families with healthcare costs the way they are, and they're probably not coming down anytime soon, being able to come to this clinic at no cost to us out of our pockets is worthwhile. You can't put a price on it. We've had a great relationship. We've had a great working clinic for years now. We are able to have our own. We aren't sharing this with anybody at the current time, so we're seeing how this rolls out. I've been blessed, my family's been blessed to have a healthy 2021, so I haven't had the opportunity to get in here yet, but I know we are working on a relationship between the firefighters and CARE ATC to provide physicals, pre-hire physicals and on-the-job physicals. So we've already got those talks in the working. So we appreciate you guys working with us on that. And I can't say enough about the relationship between labor and management with this clinic.
Well, I certainly appreciate that. One of the things, we did have the clinic in the past, which we appreciated the hard work that those folks put in. But one of the things we always really kind of wanted to focus on is if we could get something that was more centrally located that helped most of the folks. Obviously, the one closest to you is the best location, but this one here really is centrally located. That's one of the things we didn't mention during the ribbon cutting, but we're at 8th Street and Gene Guston Way, like I said, out at the old dispatch center. So it's pretty easy for most folks to get to, and it's got a nice parking area here. And like you said, what really one of the important things is to try to get as many of our employees in, whether or not they're with the fire department or police department or water department, wherever they are, because the more people utilize this, they will save money out of their pocket. And on top of it, it overall will help continue to drive down the cost of medicine and health care for everyone.
Yes, sir. Yes, sir. We appreciate it.
Well, again, I want to thank you for what you do, not just in your role as, like I said, a firefighter, but obviously as a union president and all the representation you do, working hard on behalf of your membership. And again, the good relationship that we work hard to try to maintain throughout the whole time that we're involved to make sure that folks are treated fair and right, and that we work together for the ultimate goal of serving the public. So thank you again today for being here. Sure, appreciate it. Thank you, sir. Well, I'm with Mike Anderson, and as we introduced Mike a while ago, Mike is a member of the Anderson Police Department, but he's also the president of the Fraternal Order of Police number 48 here in Anderson, as well as a member of the commission. So, Mike, talk a little bit about your work on the commission and how you view what the commission is doing on behalf of employees, but then also what this clinic means, you think, to the membership.
Well, fortunately, Mayor, I've been on the commission since the implementation of it, and it's really been a eye-opener educational situation for the employees. You know, we are self-insured, so that was one of the things where we had to educate our members that, hey, going to the ER for sinus infections and stuff like that is taking money out of your pocket. So once we were able to understand that and educate that, that has really helped as far as developing benefit packages that not only benefit the employees but also benefits the city. And that's one of the biggest things that the commission has done. And we went from a red number to a black number, and that's huge.
I remember, like you said, I know you've been on it for a number of years. Obviously, I've been in here now for 5, but I remember when I came in, we looked at the numbers where we were with our costs, and in the past there have been a few little increases in costs, but over the last 5 years, we've been able to hold that, no extra cost passed on to the employee, and none to the city, and that's amazing when you think about healthcare costs today.
Yeah, that's correct. You know, we have a reserve that's been able to offset some of those costs, and we need that reserve. You know, situations where, you know, that we exceed our limit, we have that money there. We didn't have that, you know, 10 years ago, and that's a huge plus for us, Mayor. But as far as the commission, that's the main thing, you know, is that it has benefited the city and the members as a whole, you know, as far as cost effectiveness and saving everybody a penny. And that's the main thing we want with that.
And what I like about this particular clinic that we have here and the relationship that we're building up with this new organization is that, number one, we have a great location, I think, for the majority of the people that live in the community, more centrally located, and a very nice parking lot, easy to get in, easy to get out. But some of these amenities where folks can come and get their drugs after they speak with their doctor and then have it sent to them and not have any copay. That's something really you don't see every day either.
Right. The clinic is outstanding because that's one of the things that you want. You want to be able to have a facility that has expert treatment, you know, for our patients, which is our members. And with that, you know, you also want to have the ability where it doesn't cost them a lot of money. And this is saving them money, saving the city money. And like you said, this is, I'm a participant here myself. This is efficient for employees, the city employees that come here. That's locations, you know, you can do the labs here. The doctor here is excellent, you know, as far as the treatment packages, you know, and it's preventative medicine. And you know what? Healthier employees, you know, provides a better service for our citizens. And that's the main thing we want, is to be able to have those people out there working and being healthy.
Well, I just want to thank you again, not only for your service as an officer for all these years, but also your work on the commission and all the leadership that you provide to the members through your presidency with the FOP. So thank you so much.
Thank you, Mayor.
Thank you.
Same to you.
Thank you. Well, I'm now with David Ikes. David is Deputy Mayor, but also Chairman of our Board of Works and a member of the Commission. And in your role, I know right now working, taking Tom's place temporarily with regards to personnel. You're involved deeply with the Commission also. So talk a little bit about the history of the Commission. I was talking to Mike a while ago. Mike was explaining that he's been on the Commission from the inception. But talk a little bit about what the purpose of the Commission was and how well it's been working out for the community.
Outside of Mike, I'm the only other member who's currently been there since the inception. The entire process of the commission was developed when I was on the city council, and it was myself and Rick Muir. But it was to get ownership within our health insurance plan, because it's a benefit to the employees. The city pays a portion of it, the employees pay a portion of it. But it was to get the employees to take ownership of the policy and make wise decisions for the employees and the insurance plan itself, because it's truly just a benefit the city contributes to, but it's a benefit that the employees own.
And I know that we were talking earlier, too, about the fact that we've been able to keep the premiums in place for the employees for the last 5 years, but also we've held down costs in general, even for the plan overall, mainly because of things like this particular clinic. Talk about what you see as what this clinic will be able to provide, especially if more employees use it, as we hopeful that they will.
We've actually held the current premiums at 6 years now. I heard you say 5, but it's actually been 6. But it's a multitude of things. The commission has made a lot of difficult decisions over the year. At one point in time, the city's health plan was $1.7 million in red. We currently have in excessive funds of $13 million now, which is in this day and age is unheard of, but it's from a lot of wonderful decisions. And this health clinic is just another major issue to try and control the cost of health care as much as you possibly can, not deprive anybody of health care, make sure they have quality health care, but at a controlled cost.
Well, I know one of the things we've talked about, too, is not only does this help employees, obviously, but it also helps overall the taxpayers in general, because not only do we have more healthy employees, but we also have not an excessive cost that the city pays as part of our fringe benefit package. And so you might talk a little bit about how that's held that cost down.
As you know, you have to provide a budget every year to the county council or city council, and one of the line items in that is the percentage of the cost of insurance that the city has to provide for each of those employees. And being holding the line for the past 6 years, that dollar amount stayed the same. We've not had to increase that, which is a direct connection to the taxpayers and what their money's going for. We've been very cognizant of that fact, making wise decisions and making all the decisions we can to hold that cost as much as we can. And there's not too many businesses that can say they've held their premiums at 6 years straight.
I'm not sure of any. So congratulations, and thank you, David, for your help and everything you're doing on the commission. Thank you.